3 kidney-friendly breakfasts to lower high creatinine fast. If you have ever wondered why your creatinine stays high even when you avoid salty foods, the answer might be in your breakfast. Stage 3 and higher kidney patients often forget that early meals set the pace for the entire day. Today, I'll show you 3 kidney-friendly breakfasts that lower creatinine, protect your kidneys, and even surprise you, plus a bonus tip that top nephrologists quietly recommend. We open with something that supports gut balance and helps your body clear waste more efficiently throughout the day. It is warm, filling, and very gentle on weakened kidneys when portioned correctly. Let's start with low-sodium oatmeal bowl with blueberries and renal-friendly protein. A warm low-sodium oatmeal bowl with blueberries and a renal-friendly source of protein can be one of the most supportive breakfasts for anyone living with stage 3 or higher kidney disease, because each part of this meal lowers the strain placed on filtration. Cooked oats in a 1-cup portion provide soluble fiber, beta-glucans, gentle complex carbohydrates, and around 6 grams of clean protein. And every one of these nutrients influences how your kidneys handle waste. Soluble fiber slows how quickly glucose enters the bloodstream, which lowers the inflammatory response that often rises when blood sugar swings too quickly. Several studies from Johns Hopkins Medicine show that stable blood sugar reduces systemic inflammation, and lower inflammation supports healthier creatinine levels because your kidneys do not have to manage the extra inflammatory waste that circulates after unstable meals. Oats also help move nitrogenous waste out of the digestive tract. When soluble fiber forms a gel in the gut, it binds waste particles that would otherwise re-enter the bloodstream, and less waste in the bloodstream means less work for already stressed nephrons. Have you ever noticed that some breakfasts make you feel heavy or sluggish, even though the meal looks healthy? That feeling often comes from what researchers call postprandial filtration load, which simply means the amount of work the kidneys must perform immediately after a meal. A controlled carbohydrate breakfast like plain oats keeps the load steady instead of overwhelming your kidneys first thing in the morning. Blueberries make this breakfast even better because a half-cup portion contains only about 60 milligrams of potassium, which fits safely into stage 3 kidney guidelines. Their anthocyanins and polyphenols support tiny blood vessels in the kidneys and reduce oxidative stress that slowly damages nephrons. Many clinical nutrition departments, including those at Cleveland Clinic, emphasize that berries are one of the few fruits that support kidney health without increasing potassium risk when eaten mindfully. Do you usually include fruit in the morning, or do you feel unsure about which ones are safe with kidney disease? Asking yourself that question helps you stay more aware of the choices that influence your kidney numbers. Portion control matters here. Most renal dietitians recommend half to 3/4 of a cup of dry oats for anyone in stage 3. This amount gives you energy without delivering excess potassium or phosphorus. When you add protein, keep it extremely kidney-friendly by choosing 1 egg white or a small amount of a renal-safe plant protein powder that is available in most American grocery stores. These protein sources give you amino acids without the phosphorus load found in regular dairy protein, which helps your kidneys maintain a safer nitrogen balance. Preparing this breakfast carefully makes a big difference. A creamy stovetop version using unsweetened almond milk or rice milk keeps potassium low while giving enough moisture for easy digestion. A second option is an overnight jar made with rolled oats and water, or a kidney-safe milk alternative. Leave out bananas, nuts, and high-phosphorus seeds because these ingredients add minerals that can build up in the bloodstream when your kidneys are not filtering at full strength. Instant-flavored packets should be avoided because many contain phosphate additives and high sodium levels that work against your goal of lowering creatinine. When you shop for oats, look for plain rolled oats or steel-cut oats without added flavors or preservatives. The label should show 0 to 5 milligrams of sodium, since sodium pushes fluid retention and raises blood pressure, which directly harms kidney filtration. For milk alternatives, unsweetened almond milk and rice milk are considered gentle choices because they contain very low potassium and do not contain added phosphorus. A few mistakes can weaken the benefit of this breakfast. Adding high potassium toppings like bananas, dates, or large portions of nuts raises potassium too much for many people in stage 3 kidney disease. Instant oatmeal products often contain preservatives that force the kidneys to process more chemicals than necessary. Very high fiber portions can also cause bloating in older adults because slower digestion can create gas and discomfort. So moderate portions keep you comfortable and protect your kidneys at the same time. A common myth suggests that oats are too high in potassium for kidney patients, yet controlled portions fit safely into a renal diet and offer benefits that outweigh the modest potassium content. The fact is that plain oats help stabilize blood sugar, reduce inflammatory waste, and keep creatinine from rising more quickly. Does this sound like a breakfast you could see yourself having at least a few times per week? Next, we move to a savory, kidney-friendly breakfast that balances clean protein with low-potassium vegetables, helping support kidney function and lower creatinine naturally. Moving into the next item, we will talk about the Renal Safe Egg, White and Vegetable Breakfast Wrap with low sodium and low potassium. Before we go forward, tell me where you are watching from and what symptoms your kidney disease at stage 3 or higher has been giving you lately. If you are trying to lower creatinine and protect your kidney function, make sure you subscribe to Kidnease and turn on notifications. And if this helped you even a little, type 1 in the comments or 0 if it did not, so I can keep improving for you. A Renal Safe Egg, White and Vegetable Breakfast Wrap can be a powerful morning choice for anyone with stage 3 or higher kidney concerns, because every part of this meal is designed to reduce strain on the kidneys. Egg whites bring a concentrated source of high-quality protein while keeping phosphorus extremely low. And this matters because damaged kidneys struggle to clear excess phosphorus from the bloodstream. When phosphorus stays high for long periods, it increases the workload on remaining nephrons and contributes to mineral imbalance that weakens bones and stiffens blood vessels. Many kidney research centers show that low phosphorus protein sources help stabilize filtration pressure inside the glomeruli, which is important for slowing the progression of chronic kidney disease. 3 egg whites offer about 10 grams of clean protein that supports muscle preservation without adding extra metabolic waste. And this balance is very valuable for people who often lose muscle due to reduced appetite. The vegetables in this wrap also play an important role because the right mix keeps potassium low while still giving the body enough antioxidants and plant-based compounds to fight inflammation. Small amounts of diced bell peppers provide vitamin C and protective carotenoids while staying low in potassium compared to many other breakfast vegetables. Zucchini adds gentle fiber that improves gut movement, and better gut movement supports the removal of nitrogen-based waste through the colon, which helps lighten the load on weakened kidneys. A small amount of cooked spinach, kept to about 1/3 cup, remains safe because heating reduces its potassium content, although the portion still needs to be controlled. Each vegetable choice matters because kidney conditions often make it harder to regulate potassium, and even slightly high levels can affect heart rhythm or raise blood pressure. The structure of the meal itself is kidney-friendly because the protein has almost no phosphorus and the vegetables stay within a low potassium range that fits the usual limit of 150 to 200 milligrams. This combination keeps the post-meal filtration load manageable, which means the kidneys face less stress after digestion. Some people do not realize that breakfast composition can change the way the kidneys handle waste throughout the day, and stable morning meals help lower inflammation triggered by blood sugar spikes. The tortilla becomes another key detail because many processed wraps contain phosphate additives that act as preservatives. These additives are highly absorbable and can raise phosphorus levels much faster than natural foods. Kidney nutrition experts often warn that these additives bypass normal digestion and reach the bloodstream rapidly, so choosing a simple whole wheat tortilla with under 120 milligrams of sodium per serving is essential. Checking labels for the phrase "no phosphate additives" helps prevent hidden sources of phosphorus that could quietly push levels higher over time. A low-sodium tortilla also protects blood pressure because people with chronic kidney disease often retain more fluid, and even small amounts of extra salt can increase swelling or raise pressure inside the kidneys. Two preparation methods make this breakfast practical. A quick skillet sauté using low-sodium spices like paprika and parsley keeps flavor fresh without relying on salt. And garlic-free seasoning blends help avoid stomach irritation that some kidney patients experience. A second method involves baking egg whites into small squares that can be stored and used for fast wraps during the week, which reduces stress on busy mornings and prevents last-minute meals that might be high in sodium or potassium. This wrap works especially well as a mid-morning breakfast because the combination of lean protein and gentle fiber creates steady energy without sudden spikes in blood sugar. Stable blood sugar helps protect kidney filtration because high glucose levels damage the tiny blood vessels inside the kidneys over time. Pairing the wrap with herbal tea such as ginger or chamomile adds additional calming plant compounds that support digestion, and these teas do not bring extra sodium or potassium. It is better to avoid dairy cheese with this meal because many cheeses contain high sodium and added phosphates that can strain the kidneys. Quick question for you. Do you find it harder to enjoy savory or sweet breakfasts when you are dealing with kidney issues? You can share in the comments by saying, "I am team savory" or "I am team sweet," because many people are surprised by how much their taste changes once their kidneys reach stage 3 or higher. Buying ingredients for this wrap needs attention because the wrong products can quickly raise the mineral load on the kidneys. Choosing tortillas with low sodium prevents accidental fluid retention, and buying egg white cartons that state no phosphate additives avoids hidden phosphorus sources. Storing tortillas in a cool, dry place helps prevent mold growth because high moisture environments allow fungi to grow quickly, which can create toxins unsafe for kidney-compromised individuals. Safety matters for certain groups. Seniors using blood pressure medications need to avoid salty vegetable mixes sold in pre-cut bags because these often contain added sodium to preserve color. Egg yolks can be included only from time to time because they contain higher phosphorus and may raise lipid levels, which is risky for people with chronic kidney disease who already face higher cardiovascular concerns. If this has been useful for your stage 3 kidney journey, tap the like button for a moment. It might look small, yet it tells YouTube that this information matters and helps kidneys reach more people who are trying to support their kidneys the right way. If you feel someone else deserves this knowledge, hit that thumbs up now. Our next choice is creamy, smooth, and unexpectedly kidney calming. So now we will move on to renal-friendly Greek yogurt parfait with low-potassium granola. A renal-friendly Greek yogurt parfait with low-potassium granola can become a steady morning support system for anyone whose kidneys are functioning at stage 3 or higher, because every part of this meal is designed to reduce the buildup of nitrogen-based waste that damaged kidneys struggle to process. Low-protein yogurt options make a real difference because too much protein in a single meal increases urea production, and urea can rise quickly in people whose filtration rate has slowed. Many kidney research divisions explain that people with chronic kidney conditions need to maintain a careful nitrogen balance, which means the body must stay in a state where protein breakdown does not exceed what the kidneys can safely clear. A half-cup serving of renal-safe yogurt helps maintain this balance because the protein is controlled, yet it still supports muscle maintenance, which weakens easily once kidney disease progresses. Fruit selection also plays a major role in supporting lower creatinine levels because safe fruits offer antioxidants and fiber without overwhelming the kidneys with too much potassium. Strawberries provide vitamin C and polyphenols that protect cell membranes inside the kidneys, and these compounds help ease inflammation that often rises when creatinine climbs. Blueberries add anthocyanins, which are known for their ability to protect fragile nephron structures from oxidative damage. Apples deliver pectin, a gentle fiber that improves gut transit time, and better gut function helps the body move nitrogen-based waste through the bowel instead of placing the entire burden on the kidneys. Each of these fruits stays under 100 milligrams of potassium per half cup, which keeps the potassium load manageable for weakened kidneys that cannot shift excess potassium as quickly as healthy kidneys. The granola becomes another important part of this meal because granola can easily contain hidden sources of sodium and phosphorus that raise cardiovascular risk in kidney patients. Choosing a version with under 70 milligrams of sodium per serving prevents unnecessary fluid retention, which is crucial because high sodium can increase pressure inside the nephrons. A low-sodium choice also protects the heart because people with advanced kidney disease often develop high blood pressure due to fluid shifts. Avoiding nuts and seeds keeps the phosphorus content low because many nuts contain highly absorbable phosphorus that damaged kidneys cannot clear well. Some kidney nutrition researchers point out that even small amounts of nut-based granola can raise phosphorus levels enough to cause problems over time, especially when taken repeatedly. Portions matter a lot for this breakfast because chronic kidney disease limits the body's ability to process certain nutrients throughout the day. A half cup of yogurt provides enough calcium and probiotics without raising the protein burden. A quarter cup of granola keeps carbohydrates steady while preventing excessive fiber intake, which can lead to bloating in people with slower digestion. A half cup of fruit gives antioxidants and natural sweetness without risking a potassium spike. Having this meal 3 to 4 times per week is considered much safer for people at stage 3 or higher because overuse of dairy-based products may introduce extra phosphorus, even in renal-safe versions. There are 2 simple recipes that turn this parfait into a consistent routine. The first option uses a rice-based granola that keeps phosphorus low and sodium controlled. This type of granola often feels lighter on the stomach, which helps people who wake up with nausea, a common symptom in kidney patients. The second option uses a smooth mixture with a small amount of ground flax as a replacement for chia. Flax provides omega-3 fatty acids that reduce inflammation and support vascular health, yet the portion remains tiny enough to stay kidney-friendly. Chia is avoided because it absorbs water quickly and may cause digestive discomfort in people who already struggle with fluid regulation. Buying yogurt for kidney health requires attention to specific labels because many regular yogurts include phosphate additives to improve texture. These additives are absorbed very quickly into the bloodstream and can raise phosphorus levels far faster than natural food sources. Looking for renal-friendly or low-protein yogurt labels reduces this risk. People should always avoid potassium-fortified products because many companies add extra minerals to increase market appeal, yet this does not work for someone with reduced kidney function. Granola should be checked for hidden nuts and seeds, since even a small amount can push phosphorus intake too high. Common mistakes occur often with this breakfast. Many people add high potassium fruits like banana or mango without realizing the risk, and this can raise potassium levels enough to affect heart rhythm. Sweetened yogurts are another issue because they often contain phosphorus additives and artificial sweeteners that strain the kidneys. Eating this meal too late at night is also risky because late digestion increases the chance of reflux, which is more common when kidney disease affects stomach emptying. A few budget-friendly adjustments can make this breakfast easier to afford for people on limited income. Cottage cheese alternatives made for renal diets offer a similar texture and controlled protein level. Homemade oat granola using low phosphorus ingredients can reduce cost and give fresher flavor while keeping every ingredient kidney safe. And now, before we wrap up, there is a powerful non-food habit that helps your kidneys clear waste more efficiently during the day. Meet gentle renal lymphatic activation routine. A gentle renal lymphatic activation routine can support people who live with stage 3 or higher kidney disease because the lymphatic system plays a major role in how the body moves waste that the kidneys can no longer manage alone. The lymphatic network carries proteins, toxins, and excess fluids through small vessels that depend entirely on movement to stay active. And this is important because chronic kidney disease slows fluid shifts and often leads to swelling in the ankles or hands. Many physical therapy programs across major medical centers explain that even a few minutes of controlled movement can improve the speed at which extracellular fluid moves toward lymph nodes, where it can be filtered. This helps the kidneys because every drop of fluid that leaves the swollen tissues reduces the pressure on the bloodstream, and this pressure reduction can lower the workload placed on already stressed nephrons. Some kidney research groups also highlight that even mild improvements in circulation around the abdominal region can support better filtration, simply because the kidneys depend on steady blood flow to function. A simple heel raise helps pump lymph upward through the calf muscles, and this matters because the lower legs hold a large amount of stagnant fluid in kidney patients due to slow sodium clearance. Torso twists increase movement in the lymphatic vessels located near the spleen and liver, which are key organs that support detoxification when kidney function declines. Controlled diaphragmatic breathing adds another layer of benefit because the diaphragm works like a natural pump that squeezes the lymphatic vessels in the chest, and studies done at major research hospitals report measurable increases in lymph flow during slow breathing. People only need 5 minutes to feel a difference, and this short time frame makes it easier to turn the routine into a daily habit. Many seniors appreciate that every movement can be performed while seated because this removes the fear of losing balance. Once kidney disease progresses, dizziness becomes common due to fluid shifts and blood pressure changes, so a safe seated option keeps the routine accessible. These movements work best after breakfast because the body handles fluid distribution more easily once food has triggered mild digestive circulation. Starting too early in the morning on an empty stomach may cause lightheadedness in some people, especially those who take blood pressure medication. People should avoid doing this routine right after having caffeinated drinks because caffeine increases heart rate and may create an uncomfortable rush sensation that makes controlled breathing harder. I want to ask you something meaningful. Have you ever noticed your legs feeling lighter after a short walk or simple stretches when your kidneys feel sluggish? Many people share that these small changes help them feel less puffy, and it can encourage others to try this gentle routine too. Now we shift toward the final wrap-up of this entire guide because the main points can help you remember what to choose during your next morning meal. The oatmeal bowl supports gut waste movement with steady fiber and keeps sodium very low. The egg white wrap offers clean protein that does not overwhelm the kidneys with phosphorus. The yogurt parfait adds controlled protein with safe low potassium fruits. The bonus routine strengthens daily waste movement through gentle lymph activation. If you found real value here, please do not leave without subscribing to Kidnease. Subscribe because we only talk about real solutions for people with kidney disease at stage 3 and higher. And if you feel I understood your struggle and gave you something worth trying, write the word relief in the comments so I know this truly supported you.